let's talk a little bit about some of the operational inefficiencies that occur that cause these systems to lose money on home health and hospice.
Well, a lot of it is, kind of how they manage staff. When you look at their, paid hours per visit as an example, or the amount of time they're in contact with patients versus non-patient time, you see kind of some big disparities. What I like to tell people is the reason you hire nurses and therapists is to take care of patients. But if you don't manage their time in a way that most of their time is taking care of patients, that's really wasted labor. If you equated it to a nursing floor, you would never have half the staff in the break room versus on the floor taking care of patients at any time. But that's essentially what a lot of hospital systems do. They've got half the staff in the break room really not doing anything. Now, they can be doing paperwork and things like that, but that's not the reason you hire clinicians. You hire them to take care of patients. So how you manage your scheduling and your expectations, making sure that the maximum amount of time is spent with patients or travel between patients is key.
I've heard that a lot of systems will have morning meetings with all their clinicians. That's got to waste a lot of time.
Oh, yeah. A morning meeting, if you look at it with a 40-hour employee, every hour that you have some of these meetings is 2.5% of your total labor. So, and since labor is 90+% of your cost, you're taking that right off the bottom line. So you're going to need meetings, but use them wisely and, limit management to X number of hours a meeting per week. Care conferences is another place where a lot of labor is wasted. You can have a lot of people there, but, the patients you're discussing at any given time probably only just affect a fraction of the people in that meeting. So the rest of the time is just a pure waste for staff. So structure those care conferences in a way that you maximize, the staff efficiency, but also the focus on the patients, make them meaningful.